Okay, let's dive right into this. Welcome to today's explainer, everyone. Today, we're going to objectively examine what is, quite frankly, a highly controversial and fundamentally different framework for understanding human health. It's called German New Medicine, or GNM, originally proposed by Dr. Ryke Geerd Hamer. Now, whether you're totally new to these concepts or you've bumped into them before, our goal today is purely focused on understanding the source material. We're going to neutrally unpack exactly what this paradigm claims, step by step. So here's our roadmap for this explainer. We'll start by defining the GNM medical paradigm, then explore the psyche-brain-organ connection. After that, we'll look at the two-phase disease pattern, dive into laterality and breast cancer, examine the healing role of microbes, and finally, look at how GNM rethinks metastases and osteoporosis.
All right, Section 1, the GNM medical paradigm, a radical shift in understanding disease.
The history behind this framework is actually deeply personal. Back in 1978, Dr. Hamer, who was an internist in an oncology clinic, tragically lost his son, Dirk. And shortly after that, Dr. Hamer himself developed testicular cancer. He surmised that there had to be a link between his severe emotional trauma and his physical illness, and this led him to radically break away from standard medicine. You see, standard medicine generally views disease as a malfunction, right? Like a failure of the body, a genetic error, maybe a hostile invasion. GNM entirely rejects this. Dr. Hamer asserted that illnesses are actually biological special programs. So the crucial point here is that in this theory, illnesses aren't biological errors at all. Instead, they're viewed as deeply ingrained evolutionary survival mechanisms triggered by very specific emotional shocks.
Moving on to Section 2, the psyche-brain-organ connection, linking psychological shock to biology.
According to the very first biological law of GNM, every single disease is initiated by what Dr. Hamer called a DHS, or Dirk-Hamer syndrome, named in honor of his son. But what exactly is a DHS? Well, it isn't just your everyday stress. It's an unexpected, highly personal biological conflict shock that catches you completely off guard. GNM theory positions this exact psychological trigger as the literal inception point for all physical diseases. Let's move on and see how this actually builds across the body. The source material outlines a very strict chronological flow. Step 1, the unexpected conflict shock impacts the psyche. Step 2, GNM claims this shock instantly registers in a specific, predetermined area of the brain, allegedly leaving a physical mark that's visible on a CT scan as these sharp, concentric target rings. And step 3, that specific brain relay communicates with its corresponding biological organ, altering its function. This could mean growing cells, losing tissue, or just changing how it works to help the individual survive that specific crisis.
Section 3, the two-phase disease pattern, active stress versus healing resolution. GNM's second biological law claims that every disease runs in two distinct phases, but there's a catch. This only happens if the underlying psychological conflict is ultimately resolved. The first phase is the conflict active, or cold phase. Think about a time your nervous system was locked in constant fight or flight. You obsess over the conflict, you lose sleep, your hands and feet get cold. Physically, GNM claims the organ is actively adapting here, perhaps growing a tumor to boost its function. But if that conflict is finally resolved, you enter the resolution, or warm phase. Your nervous system relaxes, you get extremely tired, your extremities warm up, and the body allegedly begins to repair the tissue alteration. Ironically, GNM claims this is exactly when most people actually feel sick, experiencing things like swelling, pain, and inflammation, even though it's classified in this model as the healing phase.
Section 4, Laterality and breast cancer, tracing the source of the conflict. To really grasp this, let's look at a very specific example from the source material, involving an empathetic dialogue between a mother named Sarah, who has a breast cancer diagnosis, and a GHK facilitator. To help Sarah, the facilitator first needs to figure out exactly who her conflict is about. To do this, they use something called the biological laterality clapping test. It is incredibly simple. You literally just clap your hands together. Whichever hand is on top determines your biological laterality. If Sarah's right hand is on top, GNM theory states that any condition on the left side of her body relates to a mother or child conflict. If a condition appears on her right side, it involves a partner. For left-handed individuals, those biological responses would be exactly reversed. And this brilliantly illustrates just how deeply specific this model claims to be. The facilitator looks at Sarah's exact diagnosis. Is it glandular breast cancer or intraductal, which is often known as DCIS? If Sarah has glandular cancer in her left breast, the facilitator explains this is controlled by the cerebellum, the old brain. It represents a nest worry conflict, perhaps an intense worry over a sick child. The theory says the breast tissue literally multiplied to produce more milk to help heal the child.
On the flip side, if Sarah was diagnosed with DCIS, that is controlled by the cerebral cortex, the new brain. This points to a separation conflict, feeling like her child was torn from her breast. In this case, the duct's ulcerated to widen during the stress phase, and the DCIS tumor is actually just the swelling of tissue being repaired because the conflict is now resolved. It's a completely different lens on what the body's doing.
Section 5. The healing role of microbes. Biological helpers, not enemies. Standard medicine operates heavily on Pasteur's germ theory, the idea that microbes invade the body and cause disease. Well, GNM asks us to consider the exact opposite. Do microbes cause disease, or do they actually help us heal? According to this paradigm, microbes are not malevolent pathogens out to get us, but rather biological demolition workers and healers that are active exclusively during that second, warm resolution phase we talked about earlier.
Looking at this table, you can see how in this concept, everything is tied back to embryology. If an organ grew from the endoderm layer, which is controlled by the brainstem, fungi in mycobacteria, like tubercular bacteria, arrive during the healing phase to decompose the tumor that is no longer needed. If the tissue is mesoderm, bacteria assist in repairing it. And if it's ectoderm, controlled by the cerebral cortex, GNM states that viruses, or hypothetical viruses as the source notes, assist in restoring ulcerated tissue. Going back to Sarah's story, if she had a glandular breast tumor and she finally resolved her nest worry, tubercular bacteria would naturally come in to break that tumor down. This process causes symptoms like night sweats, which the GHK facilitator would actually view as a very positive sign of healing.
Section 6. Rethinking metastasis and osteoporosis. The impact of diagnosis shocks.
Now, what's really interesting about this slide is the specific logic GNM uses regarding cancer spreading. Standard medicine claims cancer cells travel through the blood or lymph to form new tumors. GNM says this is impossible because cells literally cannot morph and cross those embryonic germ layer thresholds we just looked at. They also point to the fact that donated blood isn't screened for cancer cells. Instead, GNM argues that secondary cancers are brand new, independent conflicts, most often caused by the severe trauma of a cancer diagnosis itself. For instance, being told you have cancer can cause a sudden death fright, which immediately triggers a new biological program, cell proliferation in the lungs to help you breathe, resulting in lung cancer.
We see this exact same logic applied to osteoporosis and bone cancer as well. According to the source material, bone loss has absolutely nothing to do with estrogen or aging. Instead, imagine suffering a severe blow to your self-esteem. GNM classifies this as a self-devaluation conflict, feeling completely useless, inadequate, or worthless. For example, a woman losing a breast to surgery might suffer a severe self-devaluation, which GNM claims would cause the ribs or sternum near that area to begin decalcifying. It's only when she resolves that conflict and regains her self-worth that the bone actually rebuilds and strengthens itself.
So, we've unpacked the exact architecture of the 5 biological laws as presented in the source material, a system where our psyche, brain, and biology are inextricably linked. It presents a framework where disease is not seen as an enemy to fight, but rather a meaningful survival program trying to help us through an emotional shock. Regardless of your personal stance on conventional versus alternative medicine, this paradigm leaves us with a fascinating and really provocative question to consider. If our emotional conflicts truly dictate our physical biology down to the cellular level, just how much power does the mind hold over the body's ability to heal? Thank you for joining me on this explainer. I really hope you found this breakdown insightful.